welcome all our viewers on Facebook. We are recording live on our Facebook, on our Jamboree's Facebook. And I also want to acknowledge that tonight I have my two co-directors, Sarah Munyere and Mary Moturi. Mary is calling us all the way from Kenya. And so it's going to be a great evening. Now, tonight with us, we have our own daughter. I said it's a daughter of Kenya. For me, when I say that is because I feel like she's my own daughter. I've known her since she was speaking fluent Kiswahili. I'm not going to put her in, I'm not going to attempt to ask her to speak Swahili tonight, but I've known her for that long, since she was a little girl. And it's such an honor to see our young women and our young men grow up in our own eyes and end up being the people who are coming back to give to the same community that raised them up. And I know her mother is here on the line, and we are so proud of what you've done, Mr. and Mrs. Wamakima, raising such a beautiful daughter. So we welcomed her here as we have this Breast Cancer Awareness Month. I want all of you to be ready to hear from a fabulous woman who is beautiful outside and inside, our own daughter. Her name is Bridgette Wamakima. When I call her doctor, she responds to me with auntie. This is how humble she is. She is currently a 4th-year OBGYN resident, and she was born and raised, she was born in Kenya, but she was raised here in New Jersey. She completed her undergraduate in Rutgers University, and then she went to USC for medical school. She did not only walk away with a medical degree, she also walked away with a master's, her MBA, business administration. She is currently at Beth Israel, which is a part of Harvard Teaching Hospital, where she is working right now, and she's completing her residency there. And her interest is, she's interested in global health and working with African in diaspora. Now that last line hit me hard when she sent me this, because she's interested in working with us, the same people that raised her. So we are so proud of her. I want you to be attentive. I want you to, if you don't see your friend on the line, please text them and tell them we are here as Women to Learn. So please, everybody, if you can just lift up your hands like this, and you don't have to unmute, but I just want you to welcome Dr. Bridgette Wamakima.
Thank you so much, Auntie. I'm just gonna share my screen if that's okay.
Yes, it is.
Okay. Okay, just a little bit of background for me. As Auntie said, I am currently finishing my 4th year of OBGYN fellowship residency. And to me, this topic is very important because I talk to patients throughout in clinic and when I see them in the emergency department. And then I feel like I wish I could, there's so much information I've learned in these 4 years that I wish I could spread. And when she reached out, I said, of course, because a lot of these people in this group have helped raise me, and I feel like it's so important for me to give back. And so today I just want to touch on, of course, there's so much, and I can't cover everything in a short amount of time in terms of women, in terms of covering all that pertains to women's health. So I'll try my best to go through as much, and then I'll leave some time at the end for any questions. Just a little bit about me. As Auntie said, I completed my medical school at USC. I'm in my 4th year, which is my last year, and I'm very compassionate about global maternal and women's health. For this topic today, I really hope on hitting, mainly because this is Breast Cancer Awareness Month, I wanted to talk and fine tune this talk on cancer that affect women, and then screening guidelines and what you can do to help detect early detection and making sure that you're you're getting the proper screenings that you need to be receiving. So in this talk, we'll review the most common cancers that affect women. And then we'll go through screening guidelines for both breast cancer and cervical cancer, and then signs and symptoms to look out for endometrial and ovarian cancer. At the very end, I will leave out questions for people to address all types of spectrums that I didn't focus on in terms of even beyond just cancers and just things pertaining to women's health in general. So just to start off with the first aspect of this is the most common cancers in women are breast cancer, which is the reason why it has a whole month dedicated to it, because it's very important for us to make sure we raise awareness. Colorectal, which is the colon, endometrial cancer, which is the uterus, lung, and then cervical cancer, skin cancer, and ovarian cancer. And, in terms of the most effective way to basically get ahead of things or prevent illness is prevention more than treatment. So trying to prevent things before they get bad. So knowing what to look for, screening and preventions, and these things have shown time and time again. Multiple CDC and other large groups have done multiple studies and shown that prevention is the best way to save lives. So in terms of breast cancer screening, the breast cancer screening is what the United States Preventative Service Task Force is the one over governing body that really helps us make these recommendations. And the benefit of this is to help with early detection and early diagnosis. And so different things that people do are mammograms, as I'm sure everyone has heard of, and then self-exams. And so in terms of mammograms, there is a wide spectrum of when people should really start to consider getting a mammogram. And mainly women between age and 40 is when you should start considering getting a mammogram, which is an x-ray of the breast, if you wish to do so. And so you have the choice, but a lot of, in some different, there is another, American Cancer Society says one thing, CDC says another thing. So between 40 and 45 is kind of variable. It's not, necessary, but you can consider it. After age of 45, all of the different governing bodies that provide health education or health guidelines, they all recommend that women should start at age 45, and you should get it every year. And then if from age 45 to 54, if after every year, the screenings have been negative, then women should switch to screenings every 2 years to make sure that they're staying on top of their mammograms. So how are mammograms done? There's this picture right here of this woman, and this is you stand in front of this special x-ray machine, and then a technologist will come and place the breast on a plastic plate. And then another plate above will come and compress on the breast and then flatten the breast from above, and the x-ray will be done. Some tips about this is before going for your mammogram, make sure that sometimes, especially if you're in the window of your periods, your breast might be tender and swollen. So trying to go outside of this window. However, if it's the only time you have, it's still more important to just go. And then another tip is minimizing deodorant, because that can show up as white spots in the x-ray. So in terms of any screening, when you go and, I talk to a lot of people and they have high anxiety before they go for these testings, because one, they don't know what they'll come back as. And sometimes when you go and you get one test, they come back and they tell you, oh, things are not sure, so we need additional tests. But if your testing or your mammogram is normal, you'll just continue to get mammograms as basically yearly or every 2 years based on your age group. So between age 45 and 54, you'll continue to get them every year. And then if you are between ages of 55 to, I think it was 55, oh, sorry, right here. Yeah, 55, age 45, 55 and up, you get them every 2 years. And so when you're in that normal group, you just continue to proceed forward as recommended. However, if your results are abnormal, this is where people start to get nervous and they come into the office concerned about this, but that doesn't necessarily mean it's cancer. It just usually means that you may need additional testing for them to make sure that it's not definitively not cancer. And so this is kind of the one I wanted to give some pictures so you can understand. And so this is normal on all the way on the left side. It's a completely normal mammogram. They're able to tell you definitively, we didn't see anything abnormal. We're not concerned at all. But as you can see, it gets a little tricky because a benign cyst, which is just a cyst in the breast, can come up and they're not 100% sure. So when they see something like this, they may have to want to do additional testing, but that doesn't necessarily mean that it is cancer. And that, so sometimes they'll do a biopsy, which means it's like they get a sample of that tissue to make sure that that's normal. Sometimes it can be calcifications, but ultimately the main purpose of us doing this is to make sure that we are ruling out cancer, breast cancer. So, so in this, so if you, everything from, the normal one, they'll tell you no additional testing, but if it's any of the other ones that are a bit abnormal, they usually have you come back. And sometimes they'll even refer you to a specialist, and they cannot definitely, when they see the one all the way on the right, breast cancer, they cannot definitively say, absolutely, this is cancer until they take a sample of it. They send it to pathology, they look under a microscope, and they're able to tell us, yes, this is consistent. But, so from the beginning of mammograms, it's something you get every year and it's routine. But if they see something abnormal, you start to go down this road of additional testing, and those that can create anxiety, of course, but, and reasonably. But when you're going down that path, just I usually tell people, do not start to get too worried or don't freak out until you know the end result of what this possibly could be. As I said earlier, early detection of breast cancer saves lives. In patients who, when they detect it early, so when it's just a small area, they can do and remove this small beta cancer, and actually up to 93% have a high survival rate in the first 5 years. And I often see patients who've had mammectomies or lumpectomies. A lumpectomy is like the just removal of the small lump, versus a mammectomy is the removal of all the breast tissue. And they come into clinic and they've been able to, they've been diagnosed with breast cancer 10 years ago, and they have been able to live on to it for a normal life. Versus I've also seen when it's a lot later diagnosed, and that's a lot harder to treat. And so this is why it's really important to get these screenings, even though it's can seem like a lot of work to go to the doctors and wait. So here are some symptoms that people can look out for. And they used to recommend that people do self-exams all the time, but they noticed that self-exams cause people to have anxiety. But I just tell people, know yourself, and if you notice something abnormal, always reach out to a provider. So some changes that they notice are nipple changes, bloody discharge, any lump that you feel, changes in your breast color, so any changes that you see, pitting, which is like little dots that you might see on your breast, or any breast or nipple pain. And it can be hard, especially for some of these symptoms in younger, like reproductive age women, maybe between age 25 and 40. You might have some of these changes during your period, so it can be hard to tease out. But I usually say if you see some of these changes and they persist more than 2 weeks, then you should reach out to someone to make sure that that you're not missing something. And you might see a doctor or provider and they tell you it's not anything and that it's okay. But I always say it's better to reach out when you're concerned than wait too long, because I've seen the opposite of people waited a year with a symptom and then things are a lot further along. Another important thing is family history. And why is this important? Because they've started to discover that a lot of these cancers in general, or a lot of these things have a genetic or a genetic trait. And so if you have, or if you know a family member who has had a breast cancer, especially if you have more than one family member who's had breast cancer, we recommend getting genetic testing. And why is this important? It's a blood work. It's very simple test to do. They don't do it on everybody just because it's not necessary for everybody. But this blood test can let you know if you have something called BRCA, which stands for breast cancer antigen 1 and breast cancer antigen 2. So if you have BRCA 1, you have up to 55 to 65, which is high, a chance of developing breast cancer before age 70. And then BRCA 2 is up to 45%. And so this would, it's a good thing to know. It actually happens, these genetics are more common in white women than Black women, but still I've seen there are Black women who have these genetics who come back positive for this. So if you know that in your family, you've noticed that a lot of people even have breast cancer, another one which also is related to this is ovarian cancer, then you should reach out to your doctor and tell them, hi, I have two sisters, or my sister and my aunt both have breast cancer, so I want to get tested for this. And most people, it's a quick blood work and a lot of insurance cover it. So it shouldn't be too hard to do. And so that's the general, just, in terms of just reviewing, the main thing in terms of looking at breast cancer surveillance is getting your mammograms, and every 1 year from age 45 to 54, and then from 55 onward, getting your mammograms every 2 years, and then getting testing, the genetic testing if it runs in your family. Another cancer that I wanted to, or cervical cancer screening, just to go through, in terms of cervical cancer, it's actually pretty rare in the United States now because of pap smears, which is a great thing, but it still happens and is very common throughout the world. So cervical cancer is done with the pap, and basically pap smears is when they, and I'll show you guys a picture, is when they look for cell changes. And these are pre-cancers. So people, when your pap comes back, and some people get really anxious about this, but, and then they also do HPV testing, which is a human papilloma virus that can also cause these cell changes. And, HPV is not a sexually transmitted infection, but it is if you've had prior like sexual exposures, this is how you might contract it. So under age 21, no testing needed. The reason why is because if you were to have HPV under age 21, your body is very likely to clear it, where it wouldn't matter. But screening starts at age 21. And from 21 to 65 is when people should get screened. And you should get a pap smear every 3 years, and then between age 21 and 30, and then between 30 and 65 every 3 years, or every 5 years if you do co-testing. After 65, cervical cancer is pretty rare, so they don't recommend ongoing testing. I just want to make this a huge plug how important it is to get your paps, because cervical cancer is one of those cancers that can affect young women. I've seen women as young as 37, 38 come back with cervical cancer. So it's really important to stay on top of your pap smears. So what is a pap smear? How do they do it? As many of you, if you've seen an OBGYN, you lay back and you're placed in the stirrups here, and then they place this device, speculum exams. It's not very comfortable. And so they take a look at the cervix, and then they put a brush and they get a sample of it. And then the samples are put in a petri dish and they test it. And the reason why we do this is because cervical cancer may not cause signs or symptoms, but usually when you start to see symptoms, it's a more of an advanced disease. So they look under this microscope and they look, and this is the normal all the way here on the upper left. And then they start to look at, I'm not a pathologist, so I don't actually look at these. I just read the results when they give them back to me. And then I talk to patients about what these results mean. And so if you're negative, you just continue to test every 3 years. If you come back unclear, which is like borderline, which is the one on the upper right, we might ask you to come back in a year to get repeat testing. But then if you come back with one of the bottom twos, which is, it's not, like I said, because I have patients who get really nervous when we talk about these, it's not cancer, but it's a precancerous lesion. So then we have you come back for some samples and biopsies, and sometimes we just remove the superficial part of the cervix to help prevent it. And the reason why this is very important is because here in Europe and in the United States, cervical cancer, the cancer rates have been able to be dramatically reduced how many people actually go on to have cervical cancer, because we've done a really good job at getting screenings, getting women screened. Unfortunately, Asia and Africa, as you can see in this map, and this is why I'm really interested in this, because of health equity and making sure that all women, especially our African women, are getting the care they deserve, is because this cancer affects more people in the community, in these areas where they're not getting the cervical cancer screenings and they're not getting pap smears. So then this cervical cancer can progress without people being aware of it progressing. So and that's why, you know, in terms of, and there are a lot of projects, there's a lot of projects and a lot of charities that work on getting cervical cancer screening into these communities as well. And then the next one is endometrial cancer. This one we don't do screenings for because most of the time people present with symptoms for this. So most of the people I've seen who have endometrial cancer usually present with vaginal bleeding after they've had periods. Endometrial cancer affects women most of the time postmenopausal. So women who are already in their menopausal state. And so if you are already entered menopause, and then all of a sudden after like 1 or 2 years of being like completely in menopause, you start to have some vaginal bleeding and you don't know where it came from, I recommend you go see a doctor for this, because it's abnormal to have bleeding after you no longer have, when you have entered the state of menopause. So some symptoms, and the most common one is vaginal bleeding after menopause, but also bleeding in between your periods and pelvic pain. And when patients come to me and they say, I haven't had a period for 2 years, 2 or 3 years, and then all of a sudden I have spotting, my ears prick up and I know that they need to get testing. And so some of the risk factors for this, for endometrial cancer, is type 2 diabetes, polycystic ovarian syndrome, obesity, of course, any family history. So anything that has happened to one of your siblings, especially if one of your sisters had something, you should let a doctor know, because there might be there might be a genetic part that makes you at an increased risk of you having the same cancer as well. And then just estrogen hormonal placement therapy or other things, and tamoxifen, which is a medication used to treat for breast cancer. So these things put you at an increased risk of developing endometrial cancer. And like I said, most likely if someone has endometrial cancer, they're going to present with vaginal bleeding after they've had menopause. So what do we do? How do we test for this? One of the ways we test for this is doing a pelvic ultrasound, as you see on the left side. We put a transducer into the vagina, and it takes a look at the uterus, which is up here, and goes to see if there's any masses or lesions. And then if they're seeing anything abnormal on the pelvic ultrasound, then we then proceed with testing of that and sampling to see if it comes back positive for cancer. When we test for this, most places, I tell patients it takes about 7 to 10 weeks to get results. Some places it takes up to 2 weeks. And then if it comes back, we discuss the next steps, which is usually surgery. But it's very important if you notice any new symptoms, to get tested for this. And then the last one I wanted to quickly go through is ovarian cancer. Ovarian cancer is actually one of the ones, unlike cervical cancer, which is more common in Africa and Asia. Ovarian cancer is actually more common based on WHO, World Health Organization, is more common in Asia, Europe, and the United States. However, when I'm just looking through this, it might be more common in the United States because we do more screenings and people more detection and testing, where people come back and are found to have ovarian cancer. There's no screening or testing because ovarian cancer has non-specific symptoms. So people can feel bloating, they can feel quick, like a loss of appetite, very tired, changing in their bowel. One of the ones that a lot of women come actually to or how they present is unexplained weight loss. So they haven't been working out, they haven't been trying to lose weight or change their diet, but all of a sudden they've lost, and it's usually in a short time. 1 month they've dropped 10 pounds and they don't know what's going on, or pelvic pain. And so I always say, if you know, one time pelvic pain here or there, it's okay. If you notice a little bit change or some bloating, but if you notice a lot of these symptoms and then they come and they keep coming, they're new, but they're very persistent, and you go like a week or 2, 3 weeks and you notice that these symptoms are not going away, then I would definitely reach out to your primary care provider or an OBGYN, letting them know that you have these symptoms. Testing for this is similar to the one for endometrial cancer, where we do a transvaginal ultrasound, which is an ultrasound that we use place the probe into the vagina. We look at the same way that we can use it to look at the uterus. We can also use it to look at the ovaries. There's some CT scan can also it uses basically X-rays that can take a look at the butt, to take a look at the insides to see if there's any masses or lesions that are present. And then a blood work called the CA-125, which can be associated with ovarian cancer as well. In terms of ovarian cancer, the only way to really know is this a cancer or not is to do surgery. So if they saw something that was suspicious for cancer, and we did testing and the testing came back and you notice that it's an elevated CA-125, we would say, okay, we need to take this mass or lesion that we see out. And then if we test it and sometimes it's not cancer, it can be a cyst, it can be fibers that grow on the uterus, it can be a lot of different things that are not cancerous, but the only way to really know is to take it out and send it for testing. So that's just, it's a kind of a little bit different, and unlike the other ones where you can do biopsies beforehand and know that that you have this, ovarian cancer is the only one that you can only know after you get the surgery afterwards. So I kind of went through all of these different things pretty fast because I wanted to leave questions to just go through any additional questions that people had. But one thing I will say is, if you are concerned, it's better to be more cautious than to not. So I would say, if you are unsure of your symptoms, definitely reach out to your doctor, or at least call. And oftentimes I've had times where I've called people and I tell them, they explain their symptoms, I tell them it's okay, watch it, or versus come in, we'll see you and we'll do testing. Main takeaways from this is definitely after age 45, start to get your mammograms, get them every year until age 55, and then you can start to space them out to every 2 years. Between age 21 and 65, get your pap smears every 3 years. And then if they start to come back in between, like the one that's either in between or the one that is abnormal, then you would go for further testing, but definitely at least get in the door, get your pap smears ahead of time. And then the one for endometrial cancer, if you've already gone through menopause and you start to experience vaginal bleeding, reach out to your doctor and get testing for this. If it comes back negative, then it's negative, but you don't want to miss something that could have been picked up a bit earlier. And then the last one is, if you notice new symptoms of pelvic pain, bloating, or unintentional weight loss, where you're just losing weight without trying, and you notice it's a dramatic weight loss, then definitely reach out to your doctor about this as well. Thank you. So I wanted to leave some time about questions about this. So cervical or any cancers, breast cancer, cervical cancer, endometrial cancer, or ovarian cancer, but also if you have any questions about any of these workups in general, I just wanted to leave some time to make sure that people would be able to put their questions out there.
Perfect. Wow. Wow, what a great presentation. I've taken some notes, and we are going to be going to that section of asking questions. So I will want to encourage all whoever has questions, you can start typing them at the chat, and then we will go over them depending on how much time we have. But Dr. Wamakima, we appreciate you. And as we get ready for the Q&A, I want to give my Mrs. Munyere just a minute so that Dr. Wamakima can go get some water, and then we come and jump into Q&A. So we'll give her a minute, go get your water, and then Mrs. Munyere can just say hello and just introduce, go ahead, Sarah, and then I'll come back and do the Q&A with Dr. Wamakima.
Thank you.
Go get your water. Mm-hmm.
Thank you, Mrs. Jaloke. This has been great. I think, I learned so much within the 30 minutes, more than possibly I had known about these cancers that affect women. And Dr. Wamakima, thank you. Thank you so much for presenting and for offering to do this today. I just wanted to highlight a couple of companies that sponsors some of these events that we are able to bring to the community, and some of the companies that we've been working with, and they continue to support us. And I would like to just mention one of the companies that maybe many of you have been working with, and that is Habari Academy. Habari Academy, it's a school that is teaching Swahili, and they are located here in the United States. And if you are interested in helping your kids or even yourself learn Swahili, they are available, and they do this virtually. I am just sharing their information there so that if you're interested, you can reach out to them. I know quite a number of kids who are learning Swahili, and if you want to teach our kids Swahili, they can start speaking it, and that will be our pride. So reach out to Miss Lehema, and Miss Lehema is here online, and sign up your kids. She has great classes that are affordable for us all. Quickly, I would like to also mention HFC. This is a bank that is located in Kenya, and we work with them. You can have an account with them if you're interested in investment in Kenya or money market in Kenya. You can work with them. They are located in Kenya, and it's a bank that maybe most of us know from way back when. There's another bank that is called SBM Bank in Kenya. They're expert with small business and medium-sized business. So if you have a business in Kenya and you're looking to borrow a secured and secured loan, if you're looking to open a bank account, invest in money market and stuff like that, they are available, and they offer that kind of expertise and support. If you're looking to invest in Kenya, there's a company called Pink House Management. They specialize on real estate management. They sell land and plots, and they are also located in Kenya. All these companies, if you like to reach out to them, you can get in touch with us. We will be able to direct you to the owners, or you can go to jambolease.com, and you'll be able to see the information there for you to follow up. Thank you so much. That's all I have to do, and I know that now we have a few questions, and so we will just go right into it so that we can go to the next step.
All right. Thank you so much, Mrs. Munyere. And now I know Dr. Wamakima has her water, and you have a bunch of questions. The first question is, if a woman has dense breast tissue, what is the best way to screen? That's me. I have some dense breast. So what is the best way to screen?
That's actually a very good question. And and in terms of dense breast tissue, it's still the mammogram is the best way of screening. However, sometimes with dense breast tissue, it can come back where that in between, where it may not be cancer, but they still want to do additional testing, and they might get some biopsies. But a lot of women, especially as you get older, sometimes the tissue, usually it's more, or also you might experience dense breast tissue during certain times in your period because of hormonal changes or in your cycle. So I wouldn't say it's something to always be concerned. It's definitely not something to always be concerned about, but definitely know that if you do a mammogram and it comes back and they're like, oh, this is a little bit different, just to keep your ears open and see if you need additional testing.
Thank you. There's a question here. What do white spots around the vulva mean? White spots.
In terms of the vulva, I didn't get into vulvar cancer or vulva or vaginal cancers, but white spots can mean a lot of different things. It depends on and if you have any additional symptoms. Most of the time, there's like other irritation, like basically irritations of the vulva. Some names just to put them out there, like lichen sclerosis or lichen planus, and these are just irritations of the vulva area. And so usually when people come in with these white spots, we can give them basically topical steroids and see if their symptoms get better. If the symptoms of these white spots continue to persist, sometimes we just take a biopsy of that area. We'll send it and see what comes back. A lot of times it just comes back that it's not really much. And so we're just able to watch them. But if it ever comes back as abnormal, then we refer you to a specialist.
Perfect. Thank you. I hope whoever asked those questions, you're also taking your notes. You mentioned there's a question here. It's actually two different questions from two different people, but they concern PCOS. You mentioned PCOS was a risk factor for endometrial cancer. What is PCOS? That's the first question, but then the second question about it is, does PCOS, that's from a different person, does PCOS affect fertility? So the first question is, what is PCOS?
Yeah, so PCOS is polycystic ovarian syndrome, and basically it's a diagnosis where your ovaries make a lot of cysts, and it's kind of like a hormonal imbalance, but it can there are several risk factors, including weight gain, and then your ovaries make these cysts that release hormones that can cause the endometrium or the uterus to have increased cell or increased growth. And so that's why long-term it can cause to endometrial cancer. But not everyone who has PCOS automatically will have endometrial cancer. It's just one of the risk factors. But one of the things that are more associated with PCOS and cancer is actually infertility. So women who have PCOS sometimes do have a harder time getting pregnant. But I also see patients, because I not just deal with cancers, deal with delivering babies, and a lot of women who have PCOS are still able to get pregnant on their own. But if you've been trying for a really long time and you have PCOS, sometimes people can go see a fertility specialist, and they can give you medications to help you allow your ovaries to release or ovulate more, so that you have a higher chance of getting pregnant while you have PCOS. So it is associated with infertility, but it doesn't mean you cannot get pregnant. It just might mean that you might need some support or some help, including some medications to get pregnant.
Thank you. How effective is HPV vaccine in preventing, I think they meant cervical cancer.
Yeah, HPV vaccines are very effective, and they have increased the age range that people can get the HPV vaccine. And then now they've started, because women are the ones affected by HPV, but men are carriers, they've actually expanded the HPV vaccine to men. It's called, another name for it is Gardasil, if you want to look it up. There's a lot of commercials. I'm sure all of you have seen the Gardasil commercials, but you can start as early as age 12. And then they've expanded the age that people can receive the HPV vaccine. All right.
Thank you. I'm going to skip the next question because I also had a similar question, and I'll bring it probably towards the end. There are questions from Mary Moturi. I will skip that one, and I'll go to the next question, which is, in self-examination, what is the difference between a lump, which is like moving when you touch, and one which does not move? Which one should we be concerned about?
So in terms of the lumps, if there is a difference because of the fact that some of these lumps that move could just be dense tissue, which we talked about, or hormonal changes. A lump that doesn't move, I would say, is more concerning because it's getting stuck, or the tissue has expanded to a point where we basically another way we describe it is called fixed. So it's a fixed lump. And so if you have that, still we would proceed with the mammogram for both, but I would say that the one that's more concerning is a fixed lump.
All right. The other question here is, what is the difference between 3D and 2D mammogram? Any advantages?
In terms of the standard ones that they do is a 2D mammogram, but sometimes if some places, also it depends on like institution if they can do 3D mammograms. The advantage of the 3D mammogram is that you can get like a 3-dimensional, can give you better size and better characterization of if there is anything abnormal. But a lot of times the 2D mammogram can also still suffice in terms of screening.
Wow, these ladies are asking a lot of questions. They're getting, hey, awesome. Is the triple negative breast cancer more prevalent among Africans? That's a question there.
Yeah, triple negative breast cancer is more prevalent amongst African Americans. Unfortunately, triple negative breast cancer is also the one that is more aggressive. So it's the other hormone, basically in terms of triple negative, they test it for hormonal, if it's estrogen or progesterone responsive, and so that they're able to target their treatments towards the type of breast cancer. So when it's triple negative, it means it's less likely to respond to some of the chemotherapies that they use. So this is why it's, as they've stated, it's important to really go and get that testing.
Thank you. How would you differentiate between cancer symptoms and other STD symptoms?
That's a good question because in terms of a lot of the STD symptoms, it depends on the STD. So if it's like a lot of gonorrhea, chlamydia, those you tend to have more like vaginal abnormal discharge and itching. So those are not so much similar to cancer, but sometimes with even STDs, you can still have like vaginal bleeding. But they tend to be different versus cancer symptoms are more related to the type of cancer. So breast cancer is just described, you kind of those abnormal lesions, lumps, or skin changes. But if you're having, or if you notice post, depending on your age range as well. So if you're younger and you're having some abnormal discharge, it's probably not cancer because of your age range. We look at risk factors, but if you're having these abnormal symptoms later on, they may actually, and it's worth getting checked out. We always do STD testing because it's pretty cheap, but if they persist, we can also do testing for some of these or biopsies as well.
Thank you. I know you had already answered a question about HPV, but some of us as mothers, when our doctors used to push this so much to us, and we used to say, I'm going to go study about it. So what is the advantage of the vaccine? And should even the boys be vaccinated if they're not sexually active?
So in terms of getting boys vaccinated is because we're just trying to get rid of HPV in our community, same as like the polio vaccine, but it doesn't affect, truthfully, it doesn't affect the boys as much, but they still should get vaccinated. If they're not sexually active, is the recommendation a strong no, but I do still believe that they should get vaccinated at some point with the HPV vaccine.
Question just to ask as a follow-up on that.
Okay.
Should we as women here get vaccinated for HPV?
In terms of getting the HPV vaccine, I think it's age. They have an age range or above a range where it's no longer as beneficial. So it used to be 26, but I think that they extended it to 30. So it's like between 26 and 30 when they recommended between 12 and 26 when you should get the HPV vaccine. It used to be 2-shot series, and now it's a 3-shot series for the vaccine.
All right. Mrs. Wamakima, there's a question there from you. Could you rephrase it for me so I get it? I think it was probably part of a
It was
continuation.
a follow-up of the other question about the discharge, whereby she said that one of the cancers, there will be some kind of discharge, and so it was about STD versus cancer.
Oh, okay. So it was answered?
Yeah. It's
Perfect.
only that I typed slowly.
Oh, I got you. That's what I thought is a continuation. Okay, thank you. So the next question is, what is the effect of hormone imbalance, and what can women do to keep their hormones balanced? And then there's also a question, can deodorant cause cancer?
So I get a lot of questions about hormone imbalance, and women come in and they want to get tested. And the tests that we usually do are progesterone testing and estrogen testing. And usually, in terms of the main times we really look at hormones is when people are coming in with infertility. Otherwise, I tell people, and a lot of the other, and been trained that if you're having regular periods and things are generally, you're able to get pregnant, etc., that your hormones are overall doing what they need to do. Some people, there's some diets, I don't know as much of the diets because we don't get trained on that, but there are some diets out there that people do to kind of make themselves feel more hormonal balanced.
Does deodorant cause cancer?
Deodorant, there's some studies where they say that the aluminum containing deodorants do, but based on CDC and based on cancer.gov, which are what we use, based on their studies, they haven't seen that there's a link between deodorant and cancer. And I'm sure all of us use deodorant, but based on their studies, they haven't seen it. But there are some out there where they say that aluminum containing deodorants do cause cancer.
All right. What are some of the lifestyles that may cause cancer? Do contraceptives cause cancer? So those are two questions in one.
Yeah, those are really good questions. It depends on the cancer. So one of the ones that are really linked to lifestyle is endometrial cancer. So obesity is one of the biggest risk factors for endometrial cancer. And they actually have shown that weight loss can help reduce your risk of endometrial cancer. In terms of ovarian cancer, not much you can do. Breast cancer, not much you can do. And cervical cancer is just getting the routine pap smears to help prevent it. But one of the main ones is endometrial cancer because it's strongly linked to obesity. And then contraception actually is protective against cancer. One of the ones is the IUD. In patients who have grade 1 endometrial cancer, actually who cannot have surgery, they use IUDs to help stabilize, or even studies have shown help reverse the endometrial cancer. So, and also ovarian cancer some studies have shown that birth control can help slightly reduce the risk of ovarian cancer.
All right. Now I'm going to go to Mary's question, which I promised it was going to be the last, because I also have a part 2 for that question. What are kind of treatments, some treatments for these cancers? I know that's a whole topic for a whole, that's why I did not want to ask that question right there, because it would be a whole presentation on its own.
Yeah, you're 100% correct. I really wanted to keep this consolidated, but in terms of, it depends again, but one of those main treatments, breast cancer, ovarian cancer, or even is surgery. So a lot of the times for endometrial cancer, especially when it's very early, a lot of patients get a hysterectomy and they don't have to think about it again. Same with cervical cancer or breast cancer, they do a mammectomy. But if they see, when you do get surgery, then they do staging and they tell you, how far did this cancer get? Did it get to beyond what we took out? And if it did, that's when they add on chemotherapy. Because the purpose of surgery is to remove the large parts of the cancer. Chemotherapy is to help kill any microscopic cancer cells that we're not able to see. So if they do see that the cancer had spread to beyond where just the uterus or the cervix, et cetera, then they talk to people about So if you have basically stage 3 or stage 4 cancer, typically they'll talk to you about chemo and sometimes radiation as well, but usually surgery first and then they talk about chemo after.
All right. I still have 2 more questions. I hope you don't mind because they came in.
Yeah.
The one question is, I heard there are 2 types of IUD, copper versus hormonal. What are the pros and cons for either?
In terms of IUDs, the copper IUD lasts 10 years. Some people come in and they're like, I don't want any hormones. They really like that one because it's non-hormonal. It's copper and it helps prevent pregnancy in that way. Versus the hormonal or the Mirena IUD is local hormones. So it's hormones, but it only stays within the uterus. The benefit that now lasts 5 to 7 years and can help prevent pregnancies. The benefit of that one is it can also help with people who have like heavy bleeding, versus the copper IUD can cause heavy vaginal bleeding with periods. And then the hormonal one also can be used for people who have can be also used not just for to prevent or just not for birth control, but can actually also be used to help prevent cancer, endometrial cancer.
Thank you. And can we be 100% positive about mammogram results, and especially if the annual results are always negative?
In terms of, from what I've seen in the past, when they're negative, it's usually that they don't see anything at all. And if they are questionable, then they call it, so BI-RADS 1 is benign, so completely negative. But then if they are questionable, they do BI-RADS 2 versus BI-RADS 3. And so if they see a cyst, if they see anything that may or may not, they will say, okay, this is BI-RADS 2. And one of the things also is not only that you get your mammograms, but they have the mammograms to compare. So if you have a 2-centimeter breast cyst this year, it remains 2 centimeters next year and the following year. The likelihood that that's cancer, because it's remained at a small size and consistent, is low, because they've watched it. And even though it's showing up as something, they can say that this is not a cancer because it's remained stable. Versus if it's growing or et cetera, then they'll do a biopsy and you'll kind of go down that road. But we never say in medicine, we're always taught, and don't say 100%, but very low likelihood that there's a cancer if your mammogram is negative.
Perfect. Is there any relationship between fibroids and bloating? Is there a concern of any type of cancer when you have both of these? Should you be concerned if you have fibroids?
There is definitely, especially depending on the size of the fibroids, a chance that it can cause bloating. But fibroids are what we call benign. They are not associated with cancer, but we do take them out because some people's fibroids grow really big. They go to the point where they're really uncomfortable, or when they eat, they have, or even really bad pain. Some people's fibroids can cause heavy bleeding. And unfortunately, fibroids affect us women, African and Black women, the most. So this is something we see commonly. And also we see that it can sometimes, if people are trying to get pregnant, can prevent pregnancy. So there are times where we take a fibroid out. A woman is able, then who was not able to get pregnant before, is able to now be able to get pregnant. So we sometimes take them out for fertility or because of symptoms, people's pain or bloating, etc.
So as we come to the end, is there a way to have a lifestyle that, that would prevent all these cancers? And is it possible also to treat some of these cancers through the natural method? I know you are a medical doctor, so you might not endorse anything natural, but it's food and anything we do, would that help? Exercise or lifestyle?
Food, exercise always helps, but some of these things like ovarian, breast cancer, they have a genetic component, and it is sad. We see patients who come and they say, I've eaten everything right, I've done all the things, and it does happen, which is why it's really important, if you start to notice something off, going in and seeking care so that we can diagnose early. But always, it's never a bad thing to exercise, eat, get outside, and you know, do the things you need to do to take care of yourself when you can.
For us with daughters who struggle with very heavy, painful menstrual periods, is there a way to, what is the best way to deal with it other than just medication?
In terms of heavy periods, there's different ways that we actually use birth control for it, because a lot of heavy bleeding is caused by hormonal imbalance. So sometimes, like, we will use the pills, or if you don't want to keep doing pills, the IUD works really well for heavy bleeding as well, or a Nexplanon, which is the implant in the arm. So people who use that method has also helped people with heavy bleeding. And you know, I think that getting ahead of it, there's a lot of strings. There's also some non-hormonal, but medications you can use, like TXA or you know, progesterone only medications that can help the lining or help the balance of the hormones to help prevent the periods from being as heavy as they normally are.
Thank you. I think this question you had already addressed it, but the person is asking about the questions you doctors always ask. If we have relatives who have had cancers, does that mean that a family member can also be affected? I think you had already answered that, but
yeah, it just the fact that someone in your family who's had it, doesn't mean you definitely will, but just something to think about. And it's the same, even the ones I didn't discuss, like colorectal cancer can run in families. And so when they ask, they just are trying to tease out what your risk is. And you know, especially when I hear someone who says, I have 3 family members who've had breast cancer or 3 with ovarian cancer, then you start to think, okay, is this person also at risk?
Perfect. I think we're gonna wrap it up because you've given us generously your time, and I don't think we can thank you enough for your time. But I'm gonna ask the community, people who are here, if there's any other topics that you want us to cover as we do this community service, you can please reach to us and let us know, and we will see whether we can get people who can come and do this with us. But Dr. Wamakima, we cannot thank you enough. We are just so grateful, and we want to say thank you. I know thank you is not enough, but you have given back to us, and as you continue giving back, I pray that God will give you more and open more doors for you, and just continue doing good. It will serve you well, and we are so grateful. I hope everybody who came here learned a lot, and thank you. We appreciate you. And I'm going to ask Mrs. Moturi, calling from Nairobi, to close for us. And Mary Moturi, you want to say hi to these ladies as you close for us? Thank you so much, Dr. Wamakima.
Thank you. As we asked Mary Muturi to unmute, I just wanted to let the community know that we have this video saved. It's on our Facebook page. So if you have friends who missed, if you have friends who like to listen to this, if you yourself would like to listen to it again, you can visit our Facebook, jabolist.com. Information is there, and this is information that can save life. Thank you so much, Dr.
Thank you so much, Mugore, for leading us very well, and Sarah. Thank you so much, Dr. Bridgette, for that clear instructions and an overview of the different cancers that women can face that sometimes we take for granted. And but we are grateful that we have got our children now who can come and educate us, and especially the older generation. Sometimes they take this for granted, or they go to hospital when really there's really too late. So I hope it will be not any one of us. As we have heard, it's very important to really do those tests as much as we can. And I know we have got also other people like our sister Faith, who has got insurance, so that because some of these things are the ones which really make it difficult for people to go to hospital. but we see that we have got resources, and I'm sure Dr. Bridgette would also help us to see if we don't have an insurance, a medical insurance, how can we possibly be able to do these wellness tests even without an insurance? So we can always reach out to each other, and that's why Jambolist is here, so that it can try to connect the services with the consumers. And we are blessed also because now you can also be able to reach those who are in Kenya through Jambolist, through me who is in Kenya, and also for the services that we are offering. If you have got a problem with the land where you want to be visited, or you have got a family where you don't have anybody who can possibly take that something there, Jambolist will be able to fill in these small things that are sometimes very difficult to do. So thank you again. It's 2 a.m. here, but I'm glad to see, though I cannot see the faces, I can see the names. So thank you for joining us, and we are going to close. Maybe Dr. Bridgette might linger a little for those who might want to ask another question, but nevertheless, I think the session is closed. Let us just pray. Our Heavenly Father, we just want to thank you so much for that information that you've given us through Dr. Bridgette. We want to thank you, God, King of Glory, for her and her life, Lord, to see how much, Lord, you have brought her up. Lord, we know it is through your grace that, Lord, King of Glory, that she has reached where she has reached, and even to come back and be able to educate us. A child that was born when most of us, when she came to America, she was with us. But now she has grown up. She's a doctor. Knowledge, Lord, you have given. And even, Lord, we thank you for her parents who have been able to hold her hands to where she is, oh God. Father, I pray for each and every lady who is here and those who are not here. We know that, Lord, though there is medicine, you are the healer and the great healer. Though, and she has said, prevention is better than cure. Lord, we know that you can prevent all these diseases coming unto us, oh Lord. We know that it is your word, it is not the genetics, it is not anything but faith, Lord, King of Glory, coupled, Lord, with the actions of doing what you have asked us to do through Bridgette. And therefore, I pray for those ladies who are going through this challenge, especially through breast cancer. Father, in the name of Jesus, we pray for total healing. We also pray, Lord God, King of Glory, for all others, oh Heavenly Father, who might be going through this disease of cancer in any other form, Lord, King of Glory. Remembering our own families, Lord, who might be going through these challenges, oh God. Father, there are so many, especially here in Kenya, Lord, where we have learned a family has been wiped one after another because of cancer, Lord, King of Glory. We pray, Lord, for our medical here in Kenya, Lord, for health, Lord, King of Glory. And pray that, Father, what the new government has promised of having preventive health care, Lord, King of Glory, that it will come to be so that more people will be detected and treated before it is too late, oh God, O King of Glory. Just like doctor has said, that maybe the number of cases